Hi, y'all. My name is Julia, and I will be talking about the artistic creative activities and COVID-19. For the introduction, obviously COVID-19 has taken a toll on us mentally and physically. COVID-19, with the pandemic, we have had to isolate, so it's made a couple of us feel trapped, and it has taken a toll on other people's mental health. So many people, including artists, musicians, and writers, have engaged in ACA to cope with the realities around them and what's going on. The paper that I'm going to talk about today is going to talk about how ACA has been regulating their emotions and supporting their mental health during COVID-19 in Australia. And it's going to talk about the risk of populations in terms of mental health and others' well-being. And then I'm going to talk about how that applies to us here in America. Oh, just kidding. So in the paper, we did a study on 653 people online. And in that study, we asked which ACA they took part in. So whether that be in playing in roles or listening to music or watching TV. And we're going to see what they stopped in the pandemic, see if they stopped doing what they usually do, what they normally do. And then we would ask them to rank their ACA in terms of making them quote unquote feel better. A couple questions we asked them. What they usually do was either watch TV or films, if they listen to music, or cooking or baking. What they stopped doing was dancing, performing in plays, singing, or if they were doing photography, they stopped that because we can't really go out. And what made people feel better during the pandemic was either listening to music, singing songs, dancing, gardening, painting, or drawing, or even playing an instrument. So what I found was that singing and dancing were the most stopped during the pandemic. People who watched TV or films were more likely to, it was more likely to affect their mental health because they were seeing what was going on, so it was stressing them out. And number 6, young people and those who took less exercise reported to have the poorest well-being. So it really affected their mental health not going out and exploring. And in conclusion, singing and dancing are efficient for emotional well-being, and listening to music is feasible and effective for ACA for emotional health well-being in the pandemic. So staying at home orders encourage people to do more activities and training things that they wouldn't have done if the pandemic was happening. And in my experience during COVID-19, I actually went out more, I started running more, and I started working out more, so I developed a routine with fitness that I now do every day. And that has definitely helped my mental health during the pandemic to go out and do stuff that I wouldn't normally do pre-pandemic.